Hello everyone, my name is Sam, I'm a GP. Welcome to my presentation today. Today I will be presenting on part 2 of the colorectal cancer screening series. Today's topic will be focused on patients who are at medium or high risk of developing bowel cancer. Please kindly read my disclaimer before I begin. Now let's begin. In the first part of this series, we have learned that what screening test to use, when to screen, and how often to screen is based on the risk profile of the individual patient. We have also learned that patient can be classified as low or average risk, at medium risk, or at high risk of developing bowel cancer. We have also discussed about FOBT, or fecal occult blood test. We have also learned that for patients who are at average or only mildly increased risk of developing colorectal cancer, FOBT or fecal occult blood test is recommended from the age of 50 until the age of 74 and can be repeated every 2 years if the test remains negative. In this presentation, we will move on to medium risk and high risk population group. First, we will discuss about patients at moderately increased risk of developing bowel cancer. To qualify as a patient at moderately increased risk of developing bowel cancer, the following criteria applies. Either you have one first-degree relative with colorectal cancer diagnosed before the age of 55, or you have two first-degree relatives with colorectal cancer diagnosed at any age, or you have one first-degree relative with colorectal cancer diagnosed at any age, plus one second-degree relative with colorectal cancer diagnosed at any age from the same side of the family. If you or any of your family member meets the above criteria, this is what you should do. An FOBT is recommended from the age of 40 onward. And this can be repeated every 2 years until the age of 49 and can be done between colonoscopy. The second thing that you can do is to have a screening colonoscopy done. This is recommended from the age of 50 years old or 10 years before the age of the youngest relative or family member diagnosed with colorectal cancer. Screening colonoscopy can be repeated every 5 years from the age of 50 or 10 years before the age of the youngest relative or family member diagnosed with colorectal cancer and can be repeated until the age of 74 years of age. In some patient population group, colonoscopy may not be suitable. Alternative would include CT colonography or sigmoidoscopy plus double contrast barium enema study. Other preventive strategy that is currently recommended in the national guideline include the use of low-dose aspirin to help prevent the development of colorectal cancer in people aged 50 to 74 years of age. Study shows that a minimum of 2.5 years of low-dose aspirin will reduce the risk of developing colorectal cancer in the future. So if you are at moderately increased risk of developing bowel cancer, consider taking low-dose aspirin. Next, we will move on to high-risk population group. High-risk population group refers to patients who are obviously at high risk of developing bowel cancer, and the following criteria applies. Either you have 3 or more first degree or second degree relatives on the same side of the family diagnosed with colorectal cancer, or you have a family history of Lynch syndrome, or what we call hereditary non-polyposis colorectal cancer or other related cancers, with 1 or more first degree relative or second degree relatives diagnosed with colorectal cancer and is known or suspected to have Lynch syndrome. In this case, genetic service 2-yearly or yearly colonoscopy is recommended, usually from the age of 25 years old onward, or 5 years before the age of onset of cancer in the youngest relative being diagnosed with bowel cancer. The third category of patient that is considered to have high risk of bowel cancer are those that have got a history of large number of adenomas, as shown in this picture here, throughout the bowel, or they have 2 or more first degree or second degree relatives on the same side of the family diagnosed with colorectal cancer before the age of 50, or have multiple colorectal cancer history. In this case, genetic service is also recommended, and a yearly colonoscopy is also recommended. Usually at very young age, from the age of 12 to 35 years old, and then repeated 3 yearly thereafter. Thank you very much for watching my presentation. These are my references. If you have any question regarding colorectal cancer screening, please kindly speak to a health professional for health advice. Again, thank you. Stay alive, stay safe, and stay healthy. Have a nice day. Take care. Bye-bye.